The measures that we have imposed are not my measures. These are measures that have been brought to us by those who have the knowledge, the professionals, the doctors, the medical practitioners, the scientists. They went through and we had long, long sessions with them. And this was their recommendation, that if we are to stem this virus from continuing to grow, kill people, the only thing we can do is to lock down. In fact, if we had gone by their extreme measures, they had wanted us to lock down the whole country. We had to come down to tell them we also have an economy, we also have livelihoods, which we must consider. And that is why they picked those counties that we locked down as the most heavily infected counties, and we went for what is called a partial lockdown, not even a total lockdown, a partial lockdown. As the Honorable Prime Minister has said, it is true. As a result of that partial lockdown, some segments of our economy are indeed hurting. The hospitality sector, bars. We also know that churches are not having the opportunity to gather, but at the end of the day, we have not said that people cannot pray. And we welcome people to pray in their homes. But the most important thing is that we must stay safe. And by staying safe means we do everything that is possible to follow the protocols and the guidelines that have been given to us by the health experts. The washing of hands, the social distancing, the wearing of masks, and indeed encourage those, especially of that age bracket that is most vulnerable, is the elderly, who are most susceptible to death, to be vaccinated. And as to when these measures will be removed and we can go back to normal, which is our prayer every single day, depends on how we are able to flatten this curve. When will we be able to get to an infection rate that has gone to a high of almost 27% in those counties that I've mentioned, back down to below 5%, which is the recommended level in order for us to be able to open up the economy again. So all I can say is, fellow Kenyans, I know it is difficult, but we cannot pretend that this disease is not with us. We cannot ignore the advice that we are getting from the World Health Organization, from CDC Africa, from our own experts, that the only way to save lives is to take the measures that we have taken. Please, let us work together. Let us cooperate and collaborate with our health experts. And the sooner every single Kenyan begins to do that which is necessary, the sooner we shall be able to get back to normal.